Have you ever done everything perfectly, only to find your resolve fade halfway through, just when you needed it the most? You get ready, you care, you try to keep your cool, but no matter how hard you try, the moment slips away. This talk is for you if that sounds like something you've heard before, because there is a hidden aspect that most guys don't see, especially after they get 60, that slowly takes away their staying power without them even knowing it. And you might be shocked when you see it. Stay with me, because I'll tell you the #1 easy change that helps a lot of seniors the fastest and how to get started immediately. Let's give things respect right away. You gave it a shot. You aren't lazy. You are not broken. As we become older, our nerves, blood vessels, hormones, and attentiveness change slowly. They change slowly and quietly. Then good men blame themselves. Don't do that. There is a way to go. So why the hurry? Because the problem is usually a slow, quiet process. It creeps in slowly, month after month. It looks like less stiffness, a longer warm-up time, more stops and starts, and then one day you realize that you are organizing your life around good nights and bad nights. That makes you less sure of yourself. It can push you to avoid. It can make it harder to get along. It can threaten independence in subtle ways, such as making it harder to walk, exercise, and sit down, because it's simpler to avoid being vulnerable than to rebuild it. That's how a problem in the bedroom turns into a problem with movement, a problem with confidence, a problem with, "I'm not myself anymore." We won't let that happen. Not on my watch. Here's the enemy in simple English. After you turn 60, your blood flow signals are weaker, your nerves become less sensitive, and your stay-closed veins may leak a little. Stress makes fight or flight go up. This turns down the rest and digest branch that helps keep things firm. Little mistakes pile up. There is a quiet error here. There was a silent mistake. You don't alter anything, but things change without us even knowing it. Most people don't know this. Getting an erection is a team effort. Open blood vessels, veins shut. Muscles in the pelvic floor help. Nerves send continuous messages. You keep focused on the now. You can breathe easily. The whole team feels it if even one part drifts a little. It's not your fault. It's a system. And you can tune systems. You don't need to be a doctor to comprehend the science. Picture a garden hose. Water pours in when the tap, arteries, opens. When you slightly kink the end, veins, the water stays in the hose and the pressure rises. Your brain tells your body, it's safe, and your arteries relax. The blood comes in. Veins that are close enough to hold it in place. Like a supportive hand beneath the hose, pelvic muscles help from below. If the tap isn't forceful enough or the kink isn't strong enough, the pressure goes away. We're only fixing that. A steadier tap, a better kink, firmer support, and calmer signals. Let's now count down the most important changes in sequence. We'll start with things to avoid, then move on to solutions. 7 things. Each one has the issue, the straightforward science, the effect on you after 60, and what you can do right now. As we proceed from number 7 to number 1, I'll bring up the most important things. And don't forget, stay with me for the biggest adjustment that surprises most seniors. 7. Warning. Just a drink or two. After 60, there is a problem. Even modest amounts of alcohol can dull nerve impulses and reduce blood pressure at the incorrect time. That delay can stop progress. Science in simple terms. Alcohol calms down the parts of the brain that control arousal. It makes you a little dry. It relaxes smooth muscle in a way that helps at initially but makes it harder to stay strong. Think about it. A rapid start, and suddenly the floor falls out. Personal effects after 60. You might feel like doing it, but firmness doesn't match what you want. You begin to question yourself. That doubt comes back the following time. Easy thing to do today. Try a clear experiment for 30 days. Don't drink alcohol for 3 hours before becoming intimate. Drink water or herbal tea to stay hydrated. See the difference? If you still want to drink, only have 1 drink with meals earlier in the evening, and wait 2 hours before you become intimate. What's worse, when alcohol dulls your senses, you automatically push harder to feel more. Pushing might make you feel anxious. Anxiety turns on fight or flight. That's the mistake that takes away your ability to stay without you even knowing it. 6. Position pitfall. Gravity is working against you. Problem after 60. Some positions let blood flow out of the body instead of then into the chambers. If your stay-closed veins are a little leaky, gravity can make them leak more. Science in simple terms. When you're lying on your back and your spouse is on top, blood might collect in your thighs and lower belly. Less is where you want it most. Personal effects after 60. You feel strong at first, but then you fade as you move. You say it's your mindset, but that was physics. Simple thing to do today. Use gravity. You may try spooning while lying on your side, standing with assistance, or kneeling with your hips slightly above your knees. If you're lying down, put a hard pillow beneath your hips. If you start to lose your balance, stop. Take a deep breath through your nose. Change to an angle that is better for gravity, and build up pressure again before continuing. What could be worse? When you lose your grip, worry takes over. Worry is more powerful than plans. Change sooner next time, before you have to. That's not a failure, that's a plan. 5. The distracted brain. Thoughts about your performance. After 60, the problem is, when you tell your hand, don't shake, it shakes more. Science in simple terms. Your attention system can either make signals to relax stronger or make signals to alarm stronger. Alarm makes arteries tighter and makes it harder to breathe. Relaxation opens up blood vessels and keeps the heart rate steady. Effects on people after 60. You start with the present. Then a random thought comes to mind. You think back on the past. Firmness goes away. You try to push it back. More alarm means more force. Today's simple task. Whenever you feel like you're drifting, use the 3-3-3 reset. 3 calm nasal breaths in and out. 3 mild squeezes of the pelvic floor, like stopping the flow of urine in the middle of it. More on this later. 3 seconds of immobility while touching each other all over the body, hands, chest, and thighs. Then continue. A lot of the time, this pattern changes fight or flight to rest and digest. What's worse, you lose connection when you chase sensation. When you reconnect, the feeling generally comes back on its own. First, make a connection. Sensation comes next. 4. Hidden sensitivity drop. I don't feel as much. After 60, the problem is, nerve endings can become somewhat less sensitive. The walls of blood vessels get a little stiffer. To achieve the same signal, you need more time and greater rhythm. Science in simple words. Imagine a TV with the brightness turned down. The picture is still there, but you need to touch the remote harder. That's what becoming older can do to nerves and blood vessels. The effects on people after age 60. You could start off strong, but then lose your way since the feedback is weak. You think, I'm taking too long, so you hurry. Rushing cuts off arousal. Today's simple task. Lengthen the on-ramp. Double the time you spend warming up. Give your thighs, pelvis, and lower tummy additional touch. Use a lot of a body-safe, odorless lubricant. Make the room warm. Get the body warm. Warm up your mind. Not worse is slower. It's smarter to go slower. Here's the twist. When blood flow improves and the pelvic floor supports better, sensitivity typically comes back. I'll teach you the best method to work on that support in just 5 minutes a day. 3. Meds and medicals. Things that are often missed. Problem after 60. Common drugs and common health problems might change how aroused you are, your blood pressure, and how your nerves work. A lot of males never put the pieces together. Science in simple terms. Some blood pressure medicines, antidepressants, prostate treatments, and excessive blood sugar can make the tap softer or the kink looser. Sleep apnea can maintain oxygen levels low at night. If your thyroid is low, everything can slow down. Effects on people after 60. You believe the issue is only in your mind. It isn't. It's the stack. One tablet, one condition, one mistake that goes unnoticed. Today's easy task. Say this exact line to your doctor. Can we go over my medications and conditions to see if any of them might affect erections and talk about options? Ask about timing doses earlier in the day if that makes sense. Ask about checking your blood pressure, blood sugar, thyroid, and how well you sleep. If you snore and wake up feeling tired, ask about a sleep apnea test. Small changes can help you win big. Let me make it clear. This isn't about stopping medicines that are essential. It's about working with your doctor, looking for safe alternatives, and giving your body the assistance it needs to get the tap and kink to function together again. 2. The energy leak. Low nitric oxide, shallow breathing, and sitting. Problem after 60. Long periods of sitting, breathing through your mouth, and not moving around much every day can make it harder for your body to open arteries when you need them to. Science in simple terms. Your blood vessel's inner lining sends a message to your arteries to relax. This messenger works better when you move and breathe through your nose. Not moving around and breathing through your lips all the time can turn that signal down. After 60, how it affects you. You feel blah. Your legs feel heavy when you go up and down stairs. Your walk gets shorter. Confidence in the bedroom comes with daily energy. Staying power goes down when everyday energy does. Easy thing to do today. The 2x10 rule. Do a 10-minute circuit 2 times a day. Walk or march in place for 3 minutes, sit down and get up for 1 minute, and breathe slowly through your nose for 1 minute. Hold a counter for 1 minute while you do calf lifts. That's 10 minutes. If you can, add a short walk after dinner. Small, steady movements help blood flow everywhere, even where you want it most. Stay with me, because the first change connects everything and often shocks men. It's not a pill. You already have this muscle. 1. Grand reveal. Train your pelvic floor, the muscle that keeps you going. Here it is. For a lot of seniors, the most surprising and simple secret weapon is doing pelvic floor exercises the appropriate manner. These are the muscles you employ to stop pee in the middle of a stream or keep gas from coming out. When they're toned and coordinated, they help lift from below, keep veins closed better, and provide you better control when you shift positions. Why this goes back to the first promise. We started with the quiet, hidden thing that most people don't see. Stress and not getting enough support for your pelvis are 2 things that might make things worse. The system works like a team again when you teach support and quiet stress at the same time. A lot of men say to me, "I didn't know I could train that." You can. It goes quickly. It's private. It helps with many things in life, like confidence, posture, and staying dry. Science in simple terms. Think of a trampoline. A ball will sink and wobble if the fabric is loose. The ball keeps sustained if the fabric is springy. The fabric is your pelvic floor. It can droop with age. It bounces back with practice. Simple to put into action. For the first week, do the 5-5-5 plan once a day. Stand up straight. Breathe in via your nose. On the exhale, gently lift the muscles you would employ to cease urinating. Not your butt, not your stomach. Only the inner lift. Hold for 5 seconds. For 5 seconds, let go of all your stress. Do it 5 times. That's the first round. Do 3 rounds per day. 1 in the morning, 1 in the afternoon, and 1 at night. Total time, roughly 5 minutes. Progression, weeks 2 through 4. Strength, 10 holds for 6 to 8 seconds with full relaxation in between. Speed, 10 rapid lift-relax pulses, 1 every second. Endurance, hold for 20 to 30 seconds longer, breathing slowly the whole time. Checks on technique. Don't hold your breath. No strain on the face. You're squeezing too hard if you can feel your thighs or butt cheeks working hard. Try to put less effort into it by thinking of it as a inner elevator. Over time, add gentle bridges. Lay on your back with your knees bent and lift your hips a few inches. And gentle standing squeezes while you do everyday things like wash dishes. Do this while breathing through your nose and paying attention. That's the 3 things. Putting it all together. During the 3-3-3 reset we talked about, do pelvic squeezes. When you change positions, use them. Use them when you feel down. They're your quiet, steady partner. Now let's move on from problems to a full action plan that is easy for seniors to follow. Because a stack of small wins is better than one big swing, I'll give you 8 changes in order of importance. We'll go from what to avoid to what to add, and we'll make it very clear. Item 8. Don't start off dry. The problem is, dry friction lowers feeling and makes things more annoying. After age 60, skin gets thinner and nerves need gentler stimulation. Science. Lubrication lowers surface drag, which lets signals stack up instead of spreading out. Personal effect. Less pain, more rhythm, better momentum. Action. Keep a body-safe, odorless lubricant by the bed. Warm a tiny amount in your palms before usage. Reapply as needed. No shame. Smart strategy. Item 7. Empty the tank. Problem. A overly full bladder can press on pelvic nerves and disrupt the reflexes you seek. Science. Signals from the bladder that cause pressure conflict with signals that cause arousal. Competition makes it harder to concentrate. Effect on the individual. You can feel almost there and then fade away. What to do? Go to the toilet soon before you get intimate. Walk, breathe, and come back in 60 seconds. That little reset typically works. Item 6. Timing is more important than willpower. Issue: trying to force a late-night second wind after a hard day is a mistake that goes unnoticed. Science: attention, hormones, and energy are all diurnal, which means they come and go during the day. Personal effect: you go to the moment already worn out. What to do? Pick your prime time. Most seniors do better in the early evening or after a calm morning. Put connection on your calendar like you would a show you like. When it saves energy, planning is romantic. Item 5. Change the rhythm and breaks. The problem is, a lot of males push harder when velocity slows down. That typically doesn't work. Science: quick, frantic movement raises stress signals and makes blood flow less stable. Effect on the person: you feel less. They don't feel as much. Everyone is increasingly worried. Use slow build intervals. This means 40 seconds of a slower, deeper beat, 20 seconds of stillness with full body contact and breathing through the nose. Do it again. When you're still, add mild squeezes to your pelvis. The pause isn't a stop, it's a break. 4. Build blood flow every day. Issue: low daily mobility means low at-the-moment capacity. Science: your vessels work like your regular life. They keep responsive if you move around a lot. If you sit for a long time, they get stiff. How it affects you personally: dips in energy. Stairs get harder. Energy comes before firmness. What to do? Follow the 2x10 rule that was explained earlier. If you require a cane or walker, you can comfortably adapt by doing seated marches, ankle pumps, and gentle band rows. It's better to move safely than not at all. Keep it every day. Make it possible. Item 3. Strong but gentle where it matters. Issue: if your hips and glutes are weak, they can tilt your pelvis and put stress on your lower back. This makes it harder to focus and makes you less able to keep going. Science: stable hips enable the pelvic floor do its job without having to work too hard. Effect on me: less pain in the back. Better posture. Changing positions is easier. What to do? 3 moves 3 times a week. Stand up from a chair and sit back down again, 2 sets of 8 to 12. Standing hip hinges with your hands on a counter, 2 sets of 8 to 12. 2 sets of 8 to 12 bridges on the bed. Take breaks when you need them. Inhale through your nose. Here's the twist: being strong doesn't mean lifting heavy things. It's about clear messages. Small, regular doses are typically the best for seniors. 5 minutes of focused time is better than 30 minutes of distracted time. Item 2. Stop the alarms. Issue: anxiety is tricky. It shows up as tight muscles, quick choices, and shallow breathing through the mouth. Science: breathing through your mouth is often an indication of stress. Breathing via your nose warms, filters, and helps your body relax and open up. How it affects you: more comfort, more presence, more feeling. What to do? Take 1 minute to breathe through your nose before getting close to someone. Inhale for 4 counts, hold for 4, exhale for 4, and hold for 4. Do it again. Put a quiet phrase like "slow and steady" in your head. If you start to worry, go back to the 3-3-3 reset. Item 1. Secret weapon: the 5-5-5 plan for pelvic floor training. Issue: if your pelvic muscles aren't strong enough, they can't lift and assist the veins that keep blood where you want it. Science: these muscles help the body time contractions during arousal and give a slight closing assist. Personal effect: better firmness in the start, better lasting power, more control. What to do? Do the 5-5-5 plan every day for a month and then move on as planned. Use it with nasal breathing. Put in a little work. Consistency is what wins. A few optional tools. Use them with care and respect for safety. Support rings. A tight, body-safe ring at the base can help certain guys. If you try one, make sure you get the right size. Don't hurt yourself, and don't wear it for too long. Talk to your doctor first if you have neuropathy or circulation illness. Supplements. Food comes first. First, move. Get some sleep first. There is a lot of talk about some chemicals that are good for men's health. Quality and how much you take are important. These things can be different. If you think about taking any of these, talk to your doctor or chemist about them, especially if you take prescription or have a health problem. Supplements may help, but they are not cures. Professional help. Pelvic floor physical therapists who work with males can examine their development and technique, usually in just a few sessions. A lot of older people find this helpful and comforting. Putting it all together, here is your easy 5-step strategy for the next 30 days. 1. 5 minutes of daily support. The Pelvic Floor 5-5-5 plan. By the second week, add 10 rapid pulses and 1 20-second hold for endurance. 2. Move for blood flow, 20 minutes. The 2x10 rule or 2 short walks. If you don't have good balance, complete these while sitting. Consistency is more important than intensity. 3. Get ready for the moment. 3 minutes. Go to the toilet, take a little drink of water, do nasal box breathing for 1 minute, and warm up some lubricant in your hands. 4. Use rhythm wisely. 40 seconds of slow build, 20 seconds of stillness, and a 3-3-3 reset. Don't wait until you need to change positions. 5. Check the stack. When you see your doctor next, ask them to look over your medications, blood pressure, blood sugar, sleep, and thyroid. Write down what you've tried. Some questions elders ask me are, what if I've had this for a long time? It's not too late. Nerves may learn at any age. Vessels react at any age. At any age, muscles can get stronger. Your timeline might be longer. Your wins can still be real. What if I take pills to help me get an erection? Yes, a lot of males do. Don't think of those as a crutch. Think of them as a bridge. The lifestyle stack is still important. The pelvic floor is still important. The foundation of a bridge is what makes it strong. What if I've lost faith? Actions, not pep talks, build confidence. Make a plan for today in 5 minutes. Wins pile up. Next comes confidence. Important safety tips for wise men. If you have pain, a curve that makes intercourse hard, numbness, or unexpected changes, you should talk to your doctor directly. Get checked out. Sooner is better. Talk to your doctor before starting or altering any treatment if you have heart, blood pressure, eye, or prostate problems, or if you use nitrates or other heart drugs. For educational purposes only. Everything here is for general knowledge. This isn't medical advice for you. Your circumstance is one of a kind. Work with your personal doctor to make the plan fit your needs. Let's end with empowerment. You are not broken. You can change. Your body pays attention to what you do the most. It normally responds when you give it quiet air, steady movement, and a trained pelvic floor. Remember what we said about anchoring phrases. Don't make the silent mistake. You can catch what happens without even knowing it. If you notice drift, do the 3-3-3 reset. Switch positions and let your support muscles do their thing. Type 1 in the comments if this makes sense to you. Type 0 if you're not sure. Let me know what step you'll start with today. Someone else benefits from your experience. And if you want to learn more next time, stay tuned. We'll show you how to make a simple home screen to check for sleep apnea risk. Greater sleep frequently implies more energy during the day and greater performance in the bedroom. You can do this. I'm rooting for you. You can still feel like yourself again.